Hi, my name is Hilary. I'm one of the veterinary technicians at the Veterinary Dermatology Center. This video is to talk to you about how to start injectable immunotherapy for your pet. You should have gone through or home with injectable immunotherapy instructions, on the back side of which is the schedule, which I'll go over with you. You should also have your 3-vial set of allergy vaccine injections, a tray of syringes with needles, and a BD safe clip. The vaccine injections that we're going to do today, this has probably already been discussed with you, but it are beneficial for about 70% of our patients. So that does mean the vast majority of our patients are going to get good benefits from this vaccine. It can take 3 to 6 months and up to a year, however, to see full results. So during that time, we are going to use some kind of symptomatic therapy to keep your pet comfortable. If these vaccines do work for your pet, this could be a lifelong therapy, meaning your pet could be on these for the rest of his life. But that's excellent news because this is the longest or the safest long-term therapy that we can do for your pet. It's not going to take any chronic toll on his body. You want to keep this vaccine in the refrigerator. Do not freeze it. Freezing it destroys it immediately. It denatures the allergens and it ruins your vaccine. So you want to be very careful that you don't accidentally put it in a spot in your refrigerator where it might freeze. If you leave it out on your counter overnight, you come out the next morning, no big deal. Just put it right back in your refrigerator. If you leave it in your hot car for a couple days, not so good. So please don't do that. Every time you give an injection, you're going to use a fresh needle and syringe. So you're going to get that from your syringe tray, and this is what that looks like. And when you dispose of your needle, you're going to use our BD safe clip. The instructions are how to use that are on the back of it. But as a quick demonstration, you're just going to pinch it open, and then you're going to stick the needle in the tiny hole there and then chomp it off. So that means that the needle, the biohazardous portion, is safely stored in here, and the rest of the syringe and the lid can go safely in your trash can. You want to make sure you're only using the needles that we provided or insulin needles if you need. Don't put anything larger in this hole because it will jam up the hole and you won't be able to use this later. When you're giving the injection, you want to make sure you're doing it at a time not right near a major meal. So we say an hour or two on either side of the meal. The reason for that is if your dog eats and you give him an injection and then he vomits, we don't know. Is he vomiting because he ate too fast or is he having a reaction to the vaccine? Also, we don't want him to vomit up all that food he just ate and potentially aspirate on it. So for that reason, we're going to ask you to maybe give the injection when you come home from work, for example, and then an hour later, if your pet is doing fine, go ahead and put down dinner. For that reason, we also want you to make sure that you are around your pet for the next hour or two after you give the injection, particularly while we're starting on our low dose and working up as we increase to his maintenance dose. The reason for that is we want you to know what's happening to him after the injection. A severe or anaphylactic reaction is extremely rare. Typically, it's going to start with vomiting or diarrhea. You're also going to want to watch for facial swelling, trouble breathing, trouble walking, hives. Basically, you know your pet, and if you look at him and you think something is weird, we're going to ask you to get him in the car immediately and go straight to your general practice vet or your emergency vet, whatever is most appropriate for the time of day. I tell you this not to scare you. I really don't expect anything to happen. I just want you to know what to look for and what to do should the worst happen. The most common side effect of this medication is your pet could get itchy. We are literally injecting him with things we know he's allergic to. So if you find that happening, we would ask that you please call us. We don't want you to push through and try to work yourself up to the maintenance dose and try to get him through all this itching. We want to help you. So give us a call and we'll provide guidance in this case. These injections are going to last you about 6 months. At the 5-month mark, we'll send you out an email reminding you to start looking at your supply. And when you get down to just the tiniest bit of your last bottle, give us a call. We'd like 7 to 10 days notice so that we can prepare your vaccine. We'll have you prepay for it, and that's because it's made specifically for your pet based off his allergy vaccine test results. And then we will be able to ship it out, or you can stop by the office and pick it up. We ask that you call early in the week because we do make these on Fridays, and then the following Monday it'll be ready for pickup or ship out. So again, all that information I just went over is on the front of this handout that you've been sent home with. On the back is your schedule. And you will notice when you look at your vaccine that you have 3 vials. Vial 1, Vial 2, and Vial 3. And you can see the difference between them. Vial 1 is extremely dilute. Vial 2 is 10 times stronger than Vial 1, and Vial 3, which is your long-term maintenance vial, is 10 times stronger than Vial 2. So this is what we're going to be working up your pet to and what he's going to be on long-term. You'll notice that the schedule is broken up into vials 1, 2, and 3. So your very first day, you're going to start with vial number 1, and you're going to give 0.1 milliliters. 3 days later, you'll give 0.2. 3 days after that, 0.4, and 3 days after that, 0.8. So if you want to sit down with a calendar and do every 3 days, that's fine. Or if you'd prefer to do a Monday, Thursday, or a Tuesday, Friday schedule, that works as well, just so you can keep the same 2 days going every week. After completing the 4 injections from vial 1, you're going to move on to vial number 2. You will have liquid left over in vial 1. Hold on to that liquid because vial 2 is stronger, and if your pet gets itchy on vial 2, we may go back to vial 1 and just take the process a little more slowly. Vial number 2, you repeat the process over from the beginning. So the first injection will be 0.1, 3 days later 0.2. 3 days later, after that, 0.4, and 3 days after that, 0.8. So again, 4 injections total from vial number 2 before you move on to vial number 3. Hold on to that leftover liquid. When you get to vial number 3, you're now down to once weekly injection. So if you gave 0.8 of vial number 2 on a Thursday, that means the following Thursday of the next week, you will tap into vial number 3. You're gonna give your first injection at 0.1 milliliters. A week later, 0.2, a week after that, 0.3, and a week after that, 0.35 milliliters. And as long as everything is going according to plan, that will be the long-term maintenance dose for your pet unless otherwise directed. If you are a cat owner, you're gonna follow that exact same schedule. However, you're gonna only get up to 0.3 milliliters once weekly. So that is how to give your allergy vaccine, the schedule that you're going to follow. Please watch the following video for how to administer a vaccine injection. And please never hesitate to call us if you have any questions or concerns as to how this is going for your pet. Thank you.